All right, we're going to be doing a blood transfusion today on Mr. Crowley. So I'm just going to look at my EHR, and I want to make sure that we have done a type and cross within the last 72 hours, that there's a doctor's order for it. I'm going to take a look at the indication for why we're doing a blood transfusion. I'm going to take a look at his labs, a little bit of his history and everything, and then I also want to make sure that we have a signed consent form, which we do. So, yeah, and then I'm gonna go over here and I'm just gonna call the blood bank, get my blood. I wanna make sure that I use it within 30 minutes of receiving it from the blood bank. And I'm just gonna take a look at it and make sure that the color is good, that it's not expired. Looks like we're good there. I don't see any floaties in here, any issues to be concerned about. So, I'm gonna go ahead and go meet my patient. Hi, Mr. Crowley, how are we doing today?
I'm doing good.
Good. Can I just get your first and last name and date of birth?
Yeah, it's Robert Crowley, 1221.
Perfect. Okay, Mr. Crowley, we have orders to do a blood transfusion for you because your hematocrit is low and we want to help you feel better. So I'm gonna go get that set up in just a few minutes. There are a couple things I want you to be aware of. Sometimes with a blood transfusion there can be a couple different types of reactions. You may start having a fever or chills. You could have a compatibility reaction. So if you feel any back pain or chest pain, I want you to let me know. Also, if you have any itching or feel like you're having a hard time breathing, I want you to press your call out and let me know. I will be with you for the first 15 minutes of the transfusion just to make sure none of that is happening. I don't anticipate any of that happening, but I just wanted you to be aware of the reactions that could happen. So are you okay if we go ahead and get started with this process?
Yeah, that's totally fine.
Perfect. Okay. So I'm gonna leave, go get my supplies. Blood, my flush, tubing, and saline. And first we are going to do all of our checks. So I would check the type to the EHR to make sure that we got that correctly. And then I would want to make sure that we go through our little checklist sheet here. So I'm going to look at the patient's name, date of birth, any allergies. I should have asked Mr. Crowley about his allergies before, but it says that he doesn't have any. We know that's consistent. And then I want to do my bag to tag. So I'm going to look at the MRN and let's see, MRN, we're going to check that on here. And then the unit number on here is consistent with the unit number here. The type is the same. Everything looks good to me. Does everything look okay to you?
Yep, everything checks out.
So we're gonna go ahead and sign that. We've made sure everything is good. All right, so now we are going to start setting up our transfusion here. So I'm gonna take my tubing. I'm gonna make sure that everything is capped. This is not, but it should be. And I'm just going to clamp this all off to begin with. And I'm going to clamp my Y tubing up here. All right, and then one side is going to be used for our saline. So I'm gonna spike that. I'm just going to unclamp the side that has the saline. Alright, and we're going to prime this all the way down, making sure we don't have any bubbles. Also want to make sure that there is enough saline in my filter here. And And then I'm going to clamp off the saline and spike my blood. Gonna invert it a couple times before I spike it. Unclamp down here, and I'm going to let my blood run through the tubing, but I want to make sure not to waste any blood, so I'm just going to carefully watch it and let it get to the end here. Taking our time getting to the end. Alright, so that's at the end. Okay, so our blood is primed all the way. I'm just gonna go ahead and put this in my pump here. Before I get that started, I am going to flush Mr. Crowley's tubing here, and I would clean that with an alcohol swab for 10 to 15 seconds, and then I'm going to just flush a little bit. I'm making sure that nothing is infiltrating, there's no pain, there's no burning, everything looks good, it seems patent to me. So now we're gonna go ahead, connect our blood here. Okay. All right, so now we're gonna program our pump here. So channel select. All right, and we're gonna do RBCs, that's correct. All right, at first we're gonna do the rate at 1 ml per hour. So I'm gonna set that to 60. Volume to be infused is 350. And I'm gonna unclamp all of my ports here. I'm gonna run through my 5 rights really quick, making sure that we have the right drug, right patient, right time, right route, all of that. And then I'm gonna go ahead and start it. And then I'm gonna stay with Mr. Crowley for 15 minutes. I would do a full set of vitals in the beginning, make sure that he's not having any type of reaction at all. Mr. Crowley, you feeling good?
Mm-hmm.
Okay, and then we're gonna simulate. 15 minutes has been up. I'm gonna take another full set of vitals, and then after that, I'm going to change my rate. So I'm going to pause this, and I'm going to change my rate so that it finishes in 2 to 3 hours, the whole infusion. So we're gonna switch that to 150. I'm gonna restart that. And yeah, we're just gonna make sure that Mr. Crowley is doing good, which it looks like he is. So I'm just gonna go ahead and clean up my supplies here, throw all of that away, take my gloves off, do some hand hygiene before I leave the room, and then I am going to go chart everything that we just did, including the rates I set it at, how he was doing, vitals, any education that I provided him on with all of the reactions, and we should be good.